Many Canadians are still waiting to get the vaccine, but in some parts of the country, there are lotteries to get doses that would otherwise go unused. That's led to an ethical debate. As Katherine Ward explains, experts believe these efforts not to waste a drop once again underscore the disparities in this pandemic.
We're going to drop 5 names because we are going to have less than 5 vaccines.
Waiting in the cold Saturday, a crowd gathered at a vaccine clinic in North Toronto, hoping their name would be called for a chance at a leftover dose of a COVID-19 vaccine.
Okay, first name.
The person who sent this video to Global News did not want to be identified for privacy reasons, but says they were allowed to put their name in this lottery even though they are not yet eligible. We reached out to the clinic for comment, but did not hear back by deadline. Reasons for leftover doses vary, which include unfilled or cancelled appointments. In a statement, Ontario's Ministry of Health says public health units and vaccination clinics have been directed to put in place processes to fill last-minute cancellations and end-of-day doses with people who are identified as priority populations. Susan Leroux knows what it's like to win the vaccine lottery. She stopped by a pharmacy in Vancouver to get on a wait list. But because she qualified by age, Leroux left with that much sought-after shot in the arm.
She said to me, well, actually, we had a no-show, so you can get it now. So I was like, what? Now?
Some experts say making sure priority groups getting vaccinated first is key, but at the same time suggesting no doses should be wasted, even if it means some people get the shot before they are eligible.
You can't have unfilled spots. Fill the spots. And if people are, 18 and up, I have no problem with anyone getting vaccinated if there's unfilled spots. Vaccines aren't going to expire, by the way. The Pfizer vaccine can sit for about 5 days in a refrigerator once it's been thawed. Moderna can sit for a month. Like, the vaccines aren't going to go to waste, but the spaces are going to go to waste. And there's no reason for that to happen.
Other doctors say relying on lotteries to ensure all doses are used means luck won't necessarily prevail for those most at risk.
We have to recognize that this is not an equal opportunity virus. When we pull a name out of a hat in terms of who gets the COVID-19 vaccine, it can mean that people are left out. I think that there has to be a more effective way to make sure that extra doses are going to those who need it.
Currently, there is no national strategy on what to do with leftover COVID vaccine doses. Such policies are up to provincial and local authorities. Robin?
Katherine Ward in Toronto. Thanks, Katherine.